Hi, welcome to Case of the Day. One case every day from Monday to Thursday, discussing a case I've reported or biopsied the same day. And so this is today's case, dextrocardia, Situs Inversus, and Bronchiectasis. So this 36-year-old presented with cough and expectoration. That's the radiograph. So there's dextrocardia. You see the gastric bubble on the right side. So there's Situs Inversus, and uh, because of the heart on the right side, the diaphragm is down, which is very interesting. Uh, and then the CT clearly shows that the left middle lobe is bronchiectatic, shows the right lingular, and then both lower lobes show tubular, and to some extent cystic bronchiectasis. And we have these ill-defined branching centrilobular nodules and tree and bud, suggestive of a superadded inflammatory or infectious bronchiolitis. And you can also pick up the dextrocardia and the situs inversus. The MINIP shows the mirror branching here, and the patient also had chronic sinusitis. So my question would be, what do you think this is? Is this ABPA, Mounier Kuhn, cystic fibrosis, and PCD? And this combination is characteristic of PCD, subtype being Kartagener. So that term is typically no longer used in most publications. Whatever I'm going to say now has been taken from these two publications. So it's a genetically heterogeneous disorder with dysfunctional ciliary motility. The organ laterality is seen in around 50% of patients. That means that you'll have either situs ambiguous or situs inversus. Prevalence and incidence are variable, and it is likely a missed diagnosis, especially if there is no abnormal laterality. And it is difficult, the diagnosis, because you don't have a specific way to diagnose. There are genetic tests, there's ciliary defect assessment, obviously absence of other causes like cystic fibrosis, etc. Typically, we see bronchiectasis in the mid and lower zones, tubular more than cystic, distal infectious bronchiolitis because they are prone to getting infections, and chronic rhinosinusitis. And if you see laterality, then it's easier to make the diagnosis, and this is seen in 50% of patients. This is a patient we had, a 15-year-old with right middle lobe, lingular, and lower lobe bronchiectasis and mucoid impaction. And this patient was genetically proven. A very smart respiratory physician ruled out cystic fibrosis and then did genetic tests to prove that this was PCD. Whereas this patient again is a classic Kartagener's, or rather PCD with laterality with dextrocardia and situs inversus. So that's pretty much it. The diagnosis of primary ciliary dyskinesia in patients without laterality may be difficult, but it should be without. But in the presence of dextrocardia and situs inversus, it becomes easier. That's the WhatsApp channel, and thank you for viewing this. Take care.